But so during the pandemic, she gained a massive social media following for her excellent science communication. And so that's what she's about today.
Fantastic. Thanks. Thank you very much, Anne. And thanks for inviting me here to give the talk. I think it's always nice to have the opportunity to come to speak about use of social media during the pandemic. It was quite a crazy time, and I think it is useful as a scientist to come speak to scientists and reflect on how that went, what went well and what didn't go so well, and also hopefully share some of my learning, maybe some of my insights if I have any with you guys. I think I'll probably start by making one sort of big admission, I think, which is that when it comes to social media, I don't really know what I'm doing. So sorry if you thought this was going to be a how-to session. I think it's difficult to navigate social media, and I think, do any of us really know what we're doing on social media? It's like the wild, wild west. It's, oh, can people hear? Sorry, can people hear online? I hope so.
We're asking to be admitted.
Yeah,
I'm letting them in.
Yes.
I'm doing it as they're coming through.
Sorry, just to make sure.
There's a delay between letting them in and that message disappearing.
Okay.
Yeah, it's a few seconds delay, so I am letting them in, don't worry.
Just kick them out if they're too late. Yeah, so I think it's still a relatively new platform, is using social media for communication. It's still quite unpredictable. It's a very fast changing area. And in fact, I was meant to originally do this talk in May, and things have changed so much. And in that time, I've actually had to go back and change quite a few of my slides, including, go forward, changing the logo on my Twitter handle, if you may be aware. It's now X. And so that just goes to show how quickly things change in the short space of time when it comes to social media. And so this kind of creates an environment that's a little bit dangerous, but also a little bit exciting, and a really big opportunity for us as scientists to communicate directly with our key stakeholders, with the people we want to engage with the public, with policymakers. So I think basically what I'm going to do today, I'll start off with a little bit of background about myself, because I don't just assume that anybody knows who I am. And then I'm going to go through some of my journey through being on Twitter, particularly through the pandemic. And I'm going to reflect and share some stories and some examples of things that happened to me. And I'm trying to draw out, I have 9 insights that I want to share with you all, which may hopefully guide some of your future science communications. So as Anne said, I started working at was the Health Protection Agency, then Public Health England, now UK Health Security Agency, back in 2009, and I was working in the National HIV Surveillance Team there. I worked in national case reporting and monitoring people in care, and then I got into the area of setting up and running a national HIV patient survey that we would integrate with our national surveillance. And so it was in July 2013 that I set up my first Twitter account. And that was really to engage with people to promote the survey, Positive Voices, and try to just have an ear to the ground of what was happening and what the interesting topics were. So it started off, I was really just in the background. I was reading and watching, and I'll get onto that more in a moment. And my followers and the people I followed were very much people working in HIV research. It was people living with HIV from the community. It was HIV charity organizations. And that was really my sort of starting point. So it was just a probably very common way of just entering to try and get that professional ear to the ground to see what's happening. And then COVID happened. And I found myself pulled into the national COVID response. So I joined the national epidemiology cell, in March 2020. And I started working in the team that basically would produce the daily numbers of cases and deaths that you would see on the dashboard or on the news every single day for 2 years. I helped set up surveillance as kind of my passion, national surveillance. So I helped was part of a small team that set up the mortality surveillance. So we combined really rapidly 4 different data sources that had death flags in them to process them on a sort of semi-automated basis on a daily basis to try and get a timely, rapid measure of deaths to inform the pandemic response. So that was my work in COVID. But then as sort of time went on, I ended up tweeting a little bit more. There was more interest in science, and I saw the opportunity to share some of my knowledge. I'll go into that a little bit more, but basically it kind of went a bit crazy from there, and I never expected it to. And I, from that point, oh, you can't actually see, the key person there is actually Princess Anne. So sorry, you can't see that. There she is. I was invited through this work. I ended up getting invited to Windsor Castle to meet the royals. I was featured in Nature's 10 in 2021. One of the top women statisticians from Significance Magazine. So it all went a little bit crazy. Never expected this, but that was the pandemic for you. So hopefully that gives you a little bit of background of where I started. So basically, as I said, I started on HIV Twitter, and I created my account sort of, like I say, to initially know what was happening with HIV. When I got a little bit more comfortable, I started tweeting a little bit. So I kind of like slowly entered that area. I live tweeted at conferences, for example, and I retweeted scientific papers. So very, very, dry, if you would, but just very much like the facts and kept it very high level. Like I say, although I never expected to use Twitter for anything more than what I ended up having, I ended up getting quite a lot from that experience, just sitting there in the background. So my number one insight from here is that it's okay to lurk. So we know that social media can be a little bit scary for many people to approach, but actually just being there and being present and seeing what the discourse is helps you as a scientist to understand the topics that are the most important on the day. So even if that's sort of just scrolling, if you're following the right accounts and you're looking at things that interest you, you can curate a nice feed that gives you some of the top information that you want. I do know a lot of people who say they've got a lot of personal development from doing things like that on Twitter. So more than even say we love journal clubs, don't we? And things like that, going on a course here and there, but actually seeing some of the data that comes out real time, reports, papers, it can actually continually work towards your personal development and understanding the cutting edge of the research. So I think as well, something I try to pull out is once you do be a bit brave enough to do things like tweeting or putting yourself out there, it's actually a really fantastic skill for communications. So I always think how hard it is to summarize your research paper into like a 350-word abstract for a conference, and then take that down to 280 characters, which is basically 2 sentences. And that's actually really challenging, but it's really important. And I rely heavily on memes on this talk, but I really like this particular meme, which is actually not, it says Albert Einstein, it's not him at all. I don't know where this came from, misattributed, but the sentiment I like a lot. If you can't explain it simply, then you don't understand it well enough. And I think that's a challenge that we should all aim to take on, is to be able to explain what we do simply. And doing that on social media is a way we can practice that skill. So now kind of going into the next phase of my Twitter experience. So as I said, in 2020, I was working on the COVID response. And actually at the very start of the pandemic, I still really kept my head down on social media. I was really just scrolling and watching. We all saw, whether it was on Twitter or is on the news, a lot of big science personalities emerge really, really quickly and take up a lot of that space. And there was such a big appetite for science and discourse and the explanations for and predictions of what might be happening. And so they sort of these other authoritative voices kind of held a lot of this space on the subject of respiratory virus. And I guess that was fine with me because I was working in HIV. So like, what did I know about respiratory viruses? I'm not an immunologist. I'm not a virologist. I sort of said, that's fine. But basically, what started to really bother me was that I started seeing a lot of misinterpretation of the data. And that I found difficult because often it was our own data, so PHE and UKHS data. And so in that way, I actually started to see where I could add something to the discourse, where I could actually help and fill a bit of a gap, because me knowing the surveillance data and the data sources and the strengths and limitations of those, things like issues like reporting lag, issues like bias in your sample, I assume we all know those things very, very well, but I think we forget that that is something that the general population don't know as well. So that's really where I started to take my steps out into sharing things on Twitter a little bit more. And so move on. So basically, as it goes, I started doing some explanations on Twitter about things like understanding maybe why you should not rely on numbers of reported at the weekends, why deaths might appear to be higher in a vaccinated population when 99% of your elderly people are vaccinated, about why you should be cautious in doing international comparisons from different countries and things, and all of that from the background that I have in the data and understanding what the strengths and limitations were. And then what ended up kind of taking off the most was when this was sort of late 2020 rather, and it was just the time when vaccinations were coming out, but also the variants were emerging. And so UKHSA started producing these variant technical briefings that were very technical. And I was part of that. So I used Twitter to do these threads. So you can do linked tweets to explain what's happening in those. And so this was the very first one that I did. So it was the third technical briefing actually, and it was the 8th of January, 2021. And I think we're up to 55 now, and I've done most of them and given little explainers about the different things that we're doing. So it was really at that point that then people took interest and my numbers started to rocket. So my insight number 2 on this topic is a phrase that I took from my ultimate Frisbee team back when I used to do that 15 years ago, which is run into the open space. So see the gap, where's the gap, anticipate where things might go and run into that space. I think we do that, try to do that a lot now with our research already. We try to understand what's coming up, what's the next interesting thing, where are the gaps and what can we fill? But there's also a way of doing that with science communications as well. What do you know that people may not know? And I think we also kind of underestimate and assume that what we know, everybody knows. And that, again, with the pandemic, we found out it's completely not the case. So never underestimate the value of your knowledge and skill set. And information is absolutely a commodity to be shared. I think I thought it was useful just to give a little bit of guidance as to sort of how, when we do our tweeting, we do our communications, how it differs from the normal thing that we do. And that's how we reach best. So on the left-hand side here, this is how we as scientists, I'm assuming mostly scientists in this room, we structure our papers usually, may vary by journal, but usually we go through these sections as it were. But when we are communicating with the general public or people who are not subject matter experts, you need to change it around a little bit. So you're starting with the conclusion. Again, think about you have 280 characters. What is the main message that you want to get across? What was the main finding from your study? Or what can we tell from the data that we have? Then you add facts and figures to support that. Then you might add some discussion. What does it mean? what can you do to protect yourself or to make some sort of intervention? And then if you have a little bit of time, you can add that bit of background and methods with that bit of nuance, strengths and limitations, etc. And you have a bit of space perhaps to do that. But oftentimes you really only have the time and interest of people to give your conclusion straight away, and then maybe have some space to go into some of your other information. So it's a very different way of communicating with the public than what we're used to. In general, I'm happy to share these slides after, but as a general thing, so I do get to give a lecture now at the London School on engagement social media. And so there are some really basic principles out there, and there is guidance about how to engage with the public. What I would say as a take home that I have learned is that the safest and best place to be is sticking to the facts and sticking to clear and precise messages, and placing yourself as a reliable, authoritative figure in the topic area that you're speaking on, and trying your best not to stray too far outside of that realm, because that's where things get a little bit tricky. Okay, so moving on. So I was tweeting these in the journey. I was tweeting these technical briefings and other, explainers on Twitter, and then without kind of accidentally went viral. Oops, sometimes it happens. So basically, what happened here? Oh, this is. I don't know if I can.
They're trying to get in. I'm trying to. That's just not.
No, more the Is it? I'll explain it.
And at the top.
No, it's fine. Don't worry. So I was doing another one of my normal tweets, just saying, okay, we had a new variant technical briefing come out. This was on the Delta. This is at the time of the Delta variant. So it was kind of, I think this was May, June, 2020. 2020? Oh my gosh, I've lost years now. I think that was it. And, 2021, I apologize. And our team had been working flat out all week. I think probably you guys have been as well, many of you in this room, to do some analysis on this variant data and get it out as quickly as we could. And behind the scenes as well, there's so many people, scientists working. There are comms teams involved. It's a very highly politicized and a very high profile environment, and getting the clearances through everything was very challenging. So this report ended up coming out at about 8 or 9 p.m. on a Saturday night. It's not something we would normally want to do, but in the interest of trying to get it out as quickly as we can, we use that. Oh, thank you. Lovely. And so what happened after that was a couple of accounts with a few 100,000 followers picked it up and got, and you can't see I think the counts on here. I think this tweet over here got like 6,000 likes, and it went a little bit viral because people thought that we were burying the data so nobody would see it on a Saturday night. And it happened to be during Eurovision. And so the accusation was that we were burying data under the cover of Eurovision so nobody would notice the data. I'd actually created a hashtag, EurovisionGate, and I found myself as the main character basically on Twitter for like a very short period of time, on COVID Twitter, a very niche element of Twitter, but without meaning to, and effectively being seen as a spokesperson and being accused of hiding data. So that was an interesting experience. And I think for me, another insight from this is if you happen to go viral, if something goes a bit wrong and or unexpectedly becomes, become the main character on Twitter, stay calm, because it does pass. It can be very stressful, but we have to remember that nowadays the news cycle is like 24, maybe 48 hours at a push, and people move on to the next thing. And so sometimes the best thing is just to sign off and wait for it to blow over. Don't engage too much, and I'll go into that more in a little bit. But I liked, this is the main character tweet, is that each day on Twitter there's one main character, and the goal is to never be it. So it's trying to find that balance, isn't it? Okay, so I thought it was important. This is just a general learning from my time on Twitter, but I think as we all remember during the pandemic, we saw the rise of the importance of good data visualization. And so people have been working on this for a very long time, but I think, again, having that interface with the public made that really prominent. And so I think we found that there were good and bad ways of doing data visualization. And I think it's only fair to use myself as an example of what it could look like, what's bad and good. So I'll show you that in a moment. But effectively, so this is an example of what we use. So this is a graph that we produced that showed how well that mortality data that I just spoke to you about previously correlated with death certificates. And effectively what we're trying to show is that after the Omicron bit of pandemic, the correlation between those two went down. So that's the lines there. And then we have a proportion where COVID is on the death certificate, proportion where it's the underlying figure. There's a lot going on, but I think it's probably no stranger to many of us that we create graphs like this with two y-axes and a lot of data in the graph. So we wanted to make a blog about this to explain this, because what we're going to do is then kind of retire that measure. This was about 6 months ago. It kind of is no longer that useful and we wanted to retire it. So I was working with our comms team to create a blog that would be public facing. And I gave them this and they sent it back and they said, we can't use that, make it simpler. So I sent it back to them and they sent it back and they said, make it simpler. And we went back and forth like 5 times and we ended up with that. Okay. And I mean, obviously it broke my heart a little bit because I'm like, the data, where is it? But in fact, that tells you the message in more of an instantaneous way than my very complicated graph did. So it's different audiences will understand it differently, but I think remembering the importance of making sure that that your data visualizations are good. And I think also my insight is that a picture can say 1,000 words. So nowadays, now with my Twitter experience, what I say to all my staff and the scientists, as I say, in the paper you're writing, make sure one of your figures, at least one, is like screenshotable and can at least summarize the main message of your paper, whether it's a graph or a forest plot or some sort of interesting visualization. I say, try to make something that will convey your message in one image. You have other ones too, but like try to have that one main image. And I think this is a nice quote here. So you're trying to get the message across. You have to get people to understand them. But if you want them to understand it, you have to get their attention first. That's the first thing. And of course, there are some concepts on the left-hand side. Well, not on the right here. We at UKHSA had the COVID dashboard, which got a lot of plaudits for the visualizations and ability to communicate data in real time, which you may remember. But there are some general concepts of how to keep things clear, but keep it simple, use color and clear text and very simple labeling. But I think another key point I would emphasize is that it doesn't have to be some really beautiful thing you created in like R, you know what I mean? It could actually be something even simpler than that. And even in the pandemic, there were people who did just drawings on pieces of paper that managed to convey complex concepts like herd immunity better than, doing massive long threads. So that's one of my other take homes. Okay. So moving into the disinformation troll, another insight that I've taken from my time on social media is that we as scientists need to start thinking like the trolls, okay? And what do I mean by that? I mean, we need to look at our data before we put it out into the public domain and think, how can this be misconstrued willfully or not? But how could is there capacity for this to be misinterpreted or taken out of context, for example? And when we do that, we can preemptively, we call it like pre-bunking. So we can add caveats, add nuance, we can emphasize certain bits and de-emphasize other bits. And again, during the COVID pandemic, we saw that with a lot, like millions and millions of eyes on every single piece of data that we put out. We were under so much scrutiny, and it does increase that risk of mis and disinformation. The example that I've used here on the right-hand side, people may or may not be aware of, but this is an example of a UKHSA data report right here. I think that's our vaccine surveillance report that we put out every week. And we had some tables there looking at vaccination by hospitalization status. And this data was picked up by a lot of anti-vaxxers. And this is a man, I don't actually know who that is, but he's on the Joe Rogan show. So a big, massive podcast with millions and millions of followers, holding up UKHSA data and saying, look, vaccines don't work. And I mean, that's an absolute nightmare for us. And A, it was how we presented the data. B, it was how we caveated that data. C, it was the denominators we used were from a particular registry and not different from a different, like a national statistic. But there's a lot of learning to be done from that. But I think had we thought ahead of time, do you think this could be taken the wrong way? That we might have avoided ourselves quite a lot of hassle in that process. I think also I put down here, so good labeling, caveats, interpretation, social listening. So this is another concept I think is really important. That's basically just knowing what the discourse is. And again, that's being on social media, you get the idea of this. What are people talking about and what might people pounce on because it's something that people really care about right now. Okay, so the next bit is really about your presence as a person on social media. And this is a little bit of a tricky one. But I'll start by saying, as a scientist on Twitter, you have the capacity to reach more people and different people than, say, a branded account. When I say branded account, I don't just mean like Greg's. I mean, it could be your study account. It could be like your team or your university or your corporate account, for example. Those accounts, they have a really big role to play in terms of like putting out reputable information, but they don't get the same reach that individual scientists or individual people could reach. And that's because people tend to look for credible experts and are more likely to take on board information that's come from somebody they already believe to be credible. Unfortunately, something coming from a government account where I work doesn't automatically mean that people think it's credible. Now, that said, how did I find a way to reach people? I think one of the ways is because I was myself on social media. So as I kind of became a little bit more comfortable, I made it an aim of mine, an active aim, to humanize myself as a civil servant, because one thing I saw happening was that the people working on the pandemic response, particularly civil servants, sort of nameless, faceless, on an ivory tower, and it was kind of behind this black curtain that nobody knew, and there was this curtain was kept down. We have a civil service code. So people, it's not easy to really put yourself out as an individual. But I found that was adding to the breeding ground of like conspiracy theories and people thinking there were more sinister motives behind some of the things we were doing. So I tried to keep mine very personal, and a human, I can't really be anything but myself, really. So yeah, anyways, I would put out so things about my personality intermixed and blended in with the professional stuff. So I could talk for 30 minutes about epidemiology, quality of life measures, but I can also talk about RuPaul's Drag Race for 30 minutes and adapting a residential property for a wheelchair user. I'll talk about, that's my son, but topics that are personal to me as well. I am more than happy to engage in biscuit-based debates, and party rings is the best biscuit, and that's a hill I will die on. They're all nodding. I see that. They're all nodding. And I mean, see, that's how you start a fight on Twitter. And then just little things like in the pandemic, we were putting a shed up and I started chronicling it. People were so into it. It's just a bit of the personal behind what you're doing. And so, yeah, I found that to be quite a useful thing, I think, because I started to become like a person and not just like UKHSA, the man, as it were. I think one thing, there's a couple of other things I think that I wanted to note from here. One other thing is that in being just myself, I was quite open about bits about my family and my personal life. I was really open about the fact that I am gay and I'm married to a woman and I have 2 kids, and talked about my wife and my family and my kids. And it's that bit has never really been an angle I've taken on Twitter, but I thought it's important to know that note that because I have had people come up to me and thank me for being open. And so that image of when we were meeting Princess Anne at Windsor Palace Castle, one of the other nominees there was a brilliant woman who was also nominated for her own award. And we were chatting there, and she did very impressive work. And then I got an email from her the next day saying, thank you so much. I didn't know how to say this to you at the time, but thank you for being just like openly gay woman scientist on Twitter. It means a lot to me to have that person there. I was like, oh my God, it's like 2023. Like, why are we, this is a thing. But I think that's just to say, for me, that was not and I've had multiple people come to me and say things like, that's never been intentional, but sometimes actually just being yourself and just existing in this world as yourself can be helpful. And I wanted to add to that and say, maybe because I worked in HIV STIs for a long time, and being straight is probably the minority in that. So I was already in a world where being open was completely accepted. And actually my line manager was a woman who was gay for 10 years. And I think so perhaps there is something subconscious about having that person be open made me think, yeah, it's okay to be open. And then I was, and then it kind of cascades down. So that was really important to me. And I just wanted to share that. Another bit on the personal side, which is more of a proactive choice that I've made, is I had mentioned that my son is a wheelchair user. So he's 6 years old. His name is Luther, and he has a rare genetic condition called ATRX syndrome. And as I started to gain a little bit of a following, I thought, this is personal, and I have to be careful how I tread here. But one thing that I can maybe do with this platform is raise a little bit of awareness about disability, about his syndrome, and about what it is to parent a child with complex health needs. And so I dabble that in here and there, and I add little information like, for example, Tesco has a lovely cart that has a particular seat that he can use. So I give that a bit of a shout out, and talking sometimes about some of his health challenges and things he's gone through. And that has been really important for me personally. But actually through that, I have, it's been important for me professionally. Since then, somebody on Twitter who I had never met before invited me to be a parent co-investigator on an NIHR grant that she was writing to try and improve systems and services for children with complex health needs. And we got the grant, and now we're working on the project, and now 5% of my time gets to work on trying to improve things like this for my son. So just to say, I think that if I hadn't done that, I wouldn't have had that opportunity, and it's a really exciting area. So I think the final insight on that one is be yourself. I do think being personable and relatable helps you to connect and interact with other people. If you're funny or think you are, that's me. I think I am. I use humor where I can, and I do just try to engage with people wherever I can. Okay. So I think the next insight that I want to cover is about more around like sort of the pitfalls around using social media. So how many people in this room know that journalists can take anything you say online and put it in their stories without linking to your tweet or anything? They can just quote what you say. Yeah, some have.
It surprised me.
Well, there you go. It surprised me the first time it happened, if I'm honest with you. But because I thought, oh, maybe at least they have to link to their tweet. No, they can act basically as though they have had a full interview with you, and it's just the things you said on Twitter and sometimes taken out of account. So I think my insight from this is anything you say can be used online. So you do have to be mindful of that because it can get taken out of context. What I really like about Twitter, though, is that as opposed to things like if you're doing like TV or radio or other types of media, I have complete control over what I say, and it's there in black and white. If it does get taken out of context or misused or something, I could say, no, look, I said this, that's not what I said. So at least I have that there and I'm in control. But I thought I would give another example of how something went a little bit wrong with this. It doesn't always go very well with kind of controlling social media and journalists using your information. So a little bit of background on this one. There was, if you're not aware, an outbreak of pediatric hepatitis that was not with no known cause. There was no viral cause or any other kind of environmental exposure. So this is in the beginning of last year, 2022. So there's this big investigation. And as epidemiologists, we do like the shoe leather epidemiology. We do big questionnaires, and what we look for is common exposures, along with all the other like phylogenetics and all the other stuff that we're doing. But with epi, we're looking at common exposures. And what we found in this big questionnaire that we did was that 70% of the affected cases had a dog. Did any of us really think that a dog was related to hepatitis? No, because probably a lot of people have dogs, especially families with kids. And so I made what I thought was quite a funny joke. Given how common dog ownership is in the UK, I think that the hypothesis is a bit far-fetched. No, maybe. Well, I don't think that this journalist got it, because I got tweeted in the quoted in the Telegraph in the headline that Meaghan Kall, an epidemiologist at UKHSA, says that the theory is far-fetched. And next thing you know, I got a call from our comms team saying, I'm sorry, why are you undermining UKHSA data? And I was like, it was a joke. Sorry. So I got a bit of a slap on the wrist on that one. But it just goes to show you how you do have to be careful about what you say. So again, as I say, control your message, and you need to stay vigilant of chances where you can take your words out of context, because anything can be quoted. Okay, so I think it would be remiss of me when I'm talking about social media to not talk about trolling and abuse. And of course, that does happen, especially when you get a few more followers. And so again, I'm giving some examples here of things that have happened previously. This is a very fresh example. This one happened 6 days ago. So what happened? UKHSA branded account put out a tweet saying, pregnant women, go get your COVID vaccine. And this is my wonderful colleague, Meaghan, actually. She was featured in the video in my team. And so I was highlighting that, and I was saying, listen to what Meaghan says and go get your COVID vaccine. Well, since Musk has taken over Twitter, there's much less content moderation and much less misinformation, combating misinformation on the site. And I really quickly, and sorry, you can't see here, it's down here. I had, I think, 200 likes, and I had about 600 comments back to that. And that is what you call a ratio. So I basically got a ton of anti-vaxxer comments on that, which you can read yourself. Some very pleasant folks out there making some pretty outrageous comments toward me. It's there too. Maybe the window needs to open again. And so, you know, these things happen. You know, you can only to a certain extent control what people are going to do on social media. It is a shame, if you ask me, that things have gotten as bad as this. And I did my best to do as much sort of blocking and muting as I could on this. But yeah, it can be a little bit of a negative place out there. And as we know, the pandemic really polarized some opinions in science. And here's an example. This was an article in The Guardian from John Edmonds of some of the abuse that he may get in the inbox. And I probably even maybe Danny might have gotten some things to this sort of effect. But yeah, I think as a result, a lot of scientists are no longer really prepared to deal with some of the abuse, and for multiple reasons are looking at other platforms with better content moderation. We'll get to that in a moment. But I think the main take homes here is know when to walk away. Something as, well, I feel seemingly benign as saying pregnant women get a vaccine. I mean, if you look at the evidence, there's really only evidence to get vaccinated and it's safe and effective, and there's almost no evidence against it. So to me, it seems like a no-brainer. But that led to a huge onslaught of abuse. Be aware sometimes that your job may make you a target, and you know that is not personal, but sometimes it can get really personal. And as a general rule, try not to react and try not to feed the trolls. There are some times when things need to be a little bit debunked and fixed and corrected, but generally people are looking for your engagement in what they're doing. And so generally I use on Twitter, and all the other platforms have different tools, but I am a very big fan of using things like a block, a mute. A soft block is where you block somebody and unblock them, and if they're following you, it stops them from following you, so you don't show up in their feed as much, so that takes heat off. You can lock your account, you can filter new accounts or bots and filter words. You can close your DMs, you can report accounts. That is not working as well as it used to, but there's lots of different tools that you can use to try and protect yourself a little bit from some of that abuse. And know your limits. Keep an eye on your mental health, and know if it becomes more stressful or more negative than positive, then that's when you need to walk away. Temporarily or permanently, you have to make a decision about what's best for you. So this leads me to my final point here. And I guess most people in this room will probably be aware that Twitter has been taken over by Elon Musk, as I mentioned before, and things have really changed on that platform as a result of a lot of changes that he's making to that, and how different content is being promoted and monetized, for example. And as a result, a lot of other platforms are taking off really rapidly. So you've got in the top there is Truth Social, there's Blue Sky and Mastodon, for example. And so my other insight here is you need to find your happy place. So there are other platforms. You can find the platform that you feel comfortable on. And if Twitter or some places are a bit too aggressive or wild, then there are other places you can go. So you've got some places like Mastodon, you've got Threads, which is like an Instagram, but in like Twitter format, like it's like writing some short messages. You've got Blue Sky, and that is like an invite only. And most of these forums are very well moderated, don't have as many bots on them, and are becoming increasingly, particularly Blue Sky at the moment, but who knows how it's going to change, becoming a place where you can have some more scientific discourse. I think we went through kind of a golden era of science in the media during COVID, during the early part of COVID, when you had a lot of people really interested in science genuinely. And I think that has, to an extent, faded away, and things have really polarized again. So if you really want to find a place where you can get good science information, Twitter still exists, but there are other platforms. A lot of scientists are also going to Substack, so that's more of a long form. It's like a blog, basically, and you can put in include a lot more nuance in your writing in that way, and people can subscribe. They can pay, but most people don't have a payment model, but it allows you to just write short reports, basically like an article, almost like Medium, how you use that. And then if you're really brave and you like to be on camera and you look good, you can go on YouTube or TikTok. And I think there's a lot more scientists using those platforms now. TikTok, for example, is picking up. And if you really want to reach a younger audience, that's where you got to be. But it's a bit much for me because I like to lay in my bed like this and do my tweets, and I don't think that's conducive to TikTok. Okay. So that's these are sort of the rules of engagement, my insights that I have to share, re-summarized here. Maybe it would have been nice to find 10, but I couldn't think of one. But in summary, yeah, I hope you found that useful. I think what I would all say as a take home is that as scientists, we are all and should all be science communicators. We should be able and willing and ready to communicate our message to the public. Otherwise, what are we doing? We're just putting data out and it's going into an ether. You're preaching to the choir in your little bubble universe of a subscription journal that only other academics can access. You need to be able to try and reach your audience. I think we've made a lot of progress with this over the course of the pandemic. And the idea of scientists going online and being a presence on social media is sometimes a little bit scary now. I think I've got like more trailblazers who've gone out and done it. But I think in any case, social media is a really good resource and a platform for scientists to use for their professional research. And so with that, I'll take questions if you have any.
Very much. Any questions in the room? I think Simon was first.
Oh, I want a controversial one. So,
It better not be about AI.
no, it's your comment about making graphics that are not ambiguous and maybe debunk proof. How do you feel that relates to now we have a more drive to open science where all our papers are not behind paywalls but openly accessible? So I know in the climate science field, this is the thing that's bitten them a little bit because people are cherry picking from the actual academic papers and misrepresenting those. Do you think we should be moving to more user-friendly, public-facing academic papers in an open science world?
You mean to be putting your clearer data viz into the papers, or like I mean, I don't see why not. I do think it is a different venue. It tends to be a different audience, but you're absolutely right. Now that we have a lot of, even like preprints, for example, like a lot of platforms now for the general public to consume your information. And I think if people are going to consume your information, you need to make it accessible to them. That doesn't mean that you can't still have some complicated graphs in there, but I think it goes back to that concept of thinking like a troll, like how could your data be misinterpreted? And sometimes you can't totally prevent that, adding as many contexts and much as you can, and just avoid double y-axes. I think that's the context. Yeah.
Josh.
I was wondering about the run into open space thing. You said you saw this sort of area where UKHSA data or whatever was being misrepresented or not being explained well. How much was that you just saw this is something you are interested in and you just responded to, and how much of that was a strategic decision of oh, I see this gap, I want to fill this gap, and I'm going to build a profile doing this?
Yeah, no, I'll be completely honest with you. I don't think it was not super strategic being I would like to be a science communicator so I can get into this space. And I don't have a problem with, there are people who want to get into that. It was really just that XKCD thing. I was just mad that people were misinterpreting data. Something's wrong on the internet. And I was really annoyed by that because I knew it was wrong and I knew how to explain it. And so, but what I didn't expect was the appetite for that information. Really, I thought, oh, I will just go explain this and it will get a few, likes. Some of the people I know will retweet it. And in fact, even I started doing a little bit I really started on Facebook, which is just to my friends. It's really locked down, but just because I wanted the people I know to understand the data a bit better. But then, yeah, what happened was that there was such a huge appetite because there was this vacuum of information on this topic that's how I realized, oh, this is a real gap, a gap that was even bigger than I had expected it to be. But I think the learning from that is that, again, probably a lot of people in this room knew the same things I knew, but who was speaking up? And not to say everybody should, because you have to, it's taking sort of risks and, but it's dead silence out there. And to be honest, also another thing that bothered me was that there was a lot of disparaging of PhD at the time, for example, and I knew a lot of people working really hard, and I thought, actually, I really want to promote the work that we're doing and say, this is good, this is great, please look at this, please look at that, because I didn't think that was happening perhaps as well as it could have. So that was another reason that I kind of started to speak up, was almost out of frustration. Yeah.
Are there any questions online?
Yeah, so there have been a couple of really lovely comments, one from Julia Gog saying wonderful talk, Meaghan, thank you, and Julia Superior, huge vote of thanks to you and your colleague Claire, who is online, for being there on Twitter, not only for the science but also for the lols, and thanks for sharing your insights. So that's really lovely. Paul Brown did raise a question earlier. I think you may have kind of touched on this towards the end. Paul, if you're still there, do you want to unmute yourself and say your question? Paul Brown, that is. Okay, so Paul has said, do you use Twitter or do you now use other platforms? The problem of disinformation on Twitter has got a lot worse since Musk took over after his changes to the blue tick system and probably algorithm changes. So yeah, you did also touch on other platforms that could be used, but I suppose your own experiences of trying to use other platforms.
Yeah, I think none of them are quite the same as Twitter, to my annoyance, because I think I would at this stage be quite happy to leave that platform, multiple reasons. And probably for me, I do, like I said, this is something I do in my spare time. Like UKHSA does not like endorse or give me time to do or anything like this. So it has to be more positive than negative. And there are some things perhaps he suggested, like removing the ability to block. I think something like that would probably drive me off the platform. So, but I kind of wait and see. So far, it's not so bad. And I'm seeing the other platforms developing and growing to be a little bit more accessible. So Blue Sky for me so far is the best, but it's invite only, and that's a little bit tricky, but it also doesn't have its own separate app. So it's like in a web browser so far, but it is developing, and they're developing more content moderation and things. So I'm really kind of on the fence. I'm going to wait it out for a few more months and see how things go. But I'm quite optimistic so Blue Sky is the app that, what's his name? Jack, let me remember the guy who invented Twitter. Jack Dorsey, thank you. Yes, that he endorses, at least. I don't know how involved he is in that, but so he started Twitter, left it, and now he's kind of started this new thing. And I think it could be quite good, but in another 6 months, who knows, something.
That's pretty much a follow-up to before. So you briefly mentioned Truth Social, which is run, I think not run, I don't know how involved he is, but I know President Trump or ex-President Trump went there and now has less followers there. So what I was wondering is, could it be that it splits up into like different political fractions? So pretty much everybody is on Twitter. You want to get your information out to everybody, especially and probably those who most disagree with you, who need to hear it the most. So do you think in the future there is a problem if everybody just migrates to like one social media where everybody agrees with them, that there is that you don't get the audience that you used to get on Twitter, and then if you go on Truth Social, like
Yeah. And I think that, so this risk of putting yourself too much into an echo chamber and into a bubble of people that you agree with you or generally have the same leanings as you. I think that's where Twitter did really well, actually, is it was fairly new. I mean, it was a neutral site in such a way that basically journalists were all there. It was really mainly just for real-time news. There was content moderation, but like it was pretty open access for everybody. And I am concerned that it could polarize and maybe say all the scientists love Blue Sky, for example, but then we all go there and the general public doesn't go there. They go on Threads or something like that. Then we lose a lot of the draw. But it's just this balance of, also, I want to get something out of it. So if the science are there, I'm probably going to go there because I find that really useful as well. So at the minute, for example, I'm on both platforms and I'm trying to cross post in both. I can only do for so long because I don't have enough time to cross post everything in every venue. But yeah, I think there is a risk, unfortunately, of that, which makes me sad. Yeah, but.
How many hours a day do you spend on social media?
Don't tell my wife this, but I mean, yeah, probably 1 or 2 hours a day, I would say in total. I mean, I've got 2 little kids at home, so I think we're mostly talking. The main time is really. I don't really go on during work hours, obviously, but it's like watching Netflix and like being on your phone at the same time, like double screen thing. That's probably, or like sometimes laying in bed, which I know is probably not that great. So yeah, that's kind of the time when I take to do that. Yes.
So I'm a new PhD student, so we haven't met, hi, but I really appreciate your openness and your kind of all these insights. I have just two questions. The first one is that, so I used to lead communications for a kind of a UK based charity around supplying PPE to the healthcare workers. And we had like quite a few academics following us as well as doctors and everyone, but we had still like a kind of a general audience as well to kind of communicate with on Twitter. I was wondering, at what point do you think that people feel obligated to like comment on social issues, for example, which is outside their domain of expertise as a scientist, for example, racial issues, or like things, sort of conflicts that are happening, or all these different kinds of, important issues that are not related to what you're doing. That's my first question.
Okay, so my question back to you, is that something that you saw within the PPE, or you're just saying because you were on, you had the presence on Twitter, so you got to see people doing that?
You mean the commenting on the,
When you were doing your social media for the PPE firm, did you see that kind of thing happening? Is that what you're
I
saying?
think I did. I mean,
Yeah.
it depends on the size of the organization, I guess.
Yeah. Yeah, so that's, I was talking with Danny about this on the walk up, is what did happen during the pandemic is everybody thought they were an armchair epidemiologist. Everybody thought they were an expert in the data. And now the same people think they're an expert on the Ukrainian war. And now they think they're in Middle East, conflict expert. And I don't know, I really don't like to be a person that says stay in your lane, because I think we can all contribute to discourse in the conversation if you have something useful to say. So you don't really just have to stay in your lane, but know your limitations, I think, about what you actually have deep expertise about. And actually, this is where, again, Twitter is really useful, is you can really get direct access to experts in military experts, or like Middle Eastern conflicts, or, like the history of, things like that are happening you are blind to. And I think always trying to be aware of like what you don't know that you don't know. What is it? There's I can't think of the name, but there's a
Donald Rumsfeld.
What?
Donald Rumsfeld.
No, there's a
Schematic, right? Like, that you know, and then you
exactly things you know, things you know you don't know, things you don't know you don't know. And I think that's the Johari's window. Sorry, look that up later. Johari's window, but that's the idea of the things you don't know that you don't know and that you were oblivious to. Anyways, I think to answer your question, yeah, there's a proliferation of that. And I think if I put myself in those shoes, do I comment on those things? No, because one, I'm a civil servant and I don't want to start any diplomatic issues. But two, I would also feel that it might undermine the credibility in the area that I do know something about by making erratic statements about other things that I don't really know about. So I think that for me, what it sometimes does when I see other people do that kind of undermines my confidence in their expertise. People are gonna do.
I have just a brief second thing, which is so you're talking about your kind of interest in accessibility and disabled kind of issues, I suppose. So when I was also kind of thinking about whether you add alt text to the different, does everyone know what alt text is? So I think there's a sort of, because obviously if you're like just a person posting on social media, you might not really feel like you need to do that, depending on like who follows you. But then if you, I guess, become a bit bigger, you have to think about at what point do you have to include alt text in everything. So I was wondering, how do you kind of navigate those?
Yeah, I'm actually quite big on accessibility. I would say I'm big proponent of it, and like you get to say reports, and we work really hard on that. I have to admit, I don't always alt text my images. What I do like about Blue Sky, I think, is they automatically alt text your images. So that is a feature that I think is fantastic, because it is extra thought and work. And if you're just firing off a text or something, or a message, can be something that you forget to do. But, I do think it is really important. And I would definitely think like branded accounts absolutely should be doing all of that stuff to make, particularly like a UKHSA account where they have public health messaging that everybody needs to access. Yeah.
Just before David, are there any more online questions?
There was just a comment from Joe earlier. If the scientific voice leaves Twitter, who will challenge the trolls? Won't misinformation just grow exponentially?
Yes, but then maybe it will be a dumpster fire that eats itself. I don't know. You know what I mean? Like this is, again, I can't see a platform like that maintaining itself for too long, because I think, being completely frank here, I think that what the new owner has underestimated is the sense of community that Twitter has created. And if it is just promoting tweets that are just luring engagement, I think eventually you kind of lose the interest in being there. So my expectation is that kind of platform wouldn't last for very long. And then either it would go under or they'd have to change direction.
Yeah, Thomas has just said, oh, we don't worry anymore that there isn't a scientific voice on MySpace. And I guess MySpace was one of the first.
Exactly.
wasn't it? And yeah.
I'm old enough to remember MySpace, yeah.
David,
I can ask afterwards, it's fine.
let's have the one last question and then I think we'll finish, but then
I'm here to see,
Meaghan,
I'm happy to
happy
say.
to have it more informal chat after the end of the session.
So, I mean, as someone who is very much at where you said you were before COVID, like I lurk on Twitter and I retweet papers occasionally, but I do follow a lot of people who do psychon. And sort of go back to your previous answer, where suddenly the Israel-Palestine war has started, and people who do a lot of psychon have started commenting on that. And like going back to what you were saying about being a person on Twitter, I feel like it's a hard line to push on people that they shouldn't comment on moral issues if they're not experts. And I was wondering where you came down on that, and like when like a moral thing becomes a factual thing and where the line is and how you handle that.
I think that's a fantastic question. I think it's actually really important. I didn't really go into this very much, but like for me, and it may be me specifically, again, I'm thinking of myself as a civil servant, there's a line. And part of what I do is dance quite close to that line, and then I back it up, and then I dance close to the line, and then I back it up, and it's always a constant balancing act, like not trying not to overstep that line, but keeping things real and interesting, not for the sake of engagement, but like keeping things real, like how I feel within moderation. Sometimes I overstep that line, like the hepatitis, but then you learn and you come back a little bit. And I think it's a tricky one because there have been times that, so again, from my own experience, there have been times that I have spoken up about things that could be considered to be anti-government policy, just a couple of times, but those things are things that I know quite a lot about and I feel passionate about. So one of those things, for example, is when we were doing the test and trace program, we didn't engage like sexual health advisors. And I used to work in an HIV clinic and I knew these people, their whole business is doing contact tracing. They're already within the NHS and they did not get engaged at all. And because I know that, and I know those people and I feel very firm and believe I did criticize that, for example. And I was prepared, but I knew when I did that, I was prepared to back it up. And it was just, that was a fact. They didn't engage this group of people. And I think that they should have. And they can say, well, you shouldn't say that. I'm like, well, this is my opinion. So that's kind of an example of getting quite close to the line. Same things on certain disability issues that I think are really important. So I do speak sometimes up against some certain underfunding and things when it comes to disability, which is, again, it's kind of related to government policy, but like I'm a mother of a child who's disabled. So come at me, bro. I'm like, if this, so there's certain things I feel like I haven't, I think it's maybe just knowing your own, if you know enough about something and you feel positioned to be able to speak to that topic because of your background or because of your experience, that's where I would feel safe to kind of step close to that boundary. I don't know anything about, Middle Eastern politics. And so, well, not anything, but I certainly wouldn't know enough to speak about it. So I know my limits on that one. And I think some people just dive straight in when reflecting on that.
Okay, sorry. Thank you very much, Meaghan. That's been a really interesting session. Anyone has more discussion or question?
Have you got to set up in
Start recording.
Oh, Lord of the Rings. If it is Lord of the Rings, I've seen Lord of the Rings, so I should